Good afternoon and happy Wednesday. My name is Kyle Sebastian, and I am the Senior Manager of Programs and Engagement here at NAMI Tennessee. And today I want to welcome you to the second webinar of our 2022 series for Bebe Campbell Minority Mental Health Awareness Month. NAMI Tennessee hosts a webinar series every July to support equitable mental health treatment, services, and support for racial, ethnic, and sexual minority populations here in Tennessee, including BIPOC, Black, Indigenous, people of color, and LGBTQ+, lesbian, gay, bisexual, transgender, and queer questioning. Before we go on, I'd like to remind everyone about NAMI, especially as we are joined here today by NAMI Michigan. NAMI, or the National Alliance on Mental Illness, is the nation's largest grassroots mental health organization dedicated to building better lives for the millions of Americans affected by mental illness. NAMI represents an alliance of 49 state organizations and over 600 local affiliate chapters. And so without further ado, let me introduce our friends from the Great Lakes State. So Kevin Fischer is the Executive Director of NAMI Michigan, a retired businessman. Kevin joined NAMI as a volunteer in 2011 after his oldest son, Dominique, was diagnosed with a mental illness in late 2007 and was lost to suicide in 2010. After serving on the NAMI Michigan Board of Directors for 4 years, Kevin accepted the role of Executive Director in 2014. A mental health and suicide prevention advocate, Kevin is the founder and director of the Dominique Fischer Memorial Foundation and CEO of EverybodyVersusStigma.com. He is also the president of Crisis Intervention Team International and serves on Michigan Governor Whitmer's Suicide Prevention Commission, the Michigan Department of Health and Human Services Mental Health Diversion Council and Behavioral Health Advisory Council, and the Disability Rights Michigan Protection and Advocacy for Individuals with Mental Illness Advisory Board. I promise all the long acronym organizations are over at this point. Quoted as saying, "This is his last job, his last fight." Kevin is dedicated to eliminating the stigma of mental illness, which he considers the leading barrier to early diagnosis and treatment, which leads to better outcomes for all. And finally, before I pass things over to Kevin, I want to share some quick housekeeping items. First, this webinar is being recorded and simultaneously streamed to those who registered on Zoom, as well as individuals joining us via the live stream on our Facebook page. Second, if at any point you have a question for Kevin, please type it into the Q&A/comments boxes on your respective platform. We will address questions asked on Zoom first, followed by any comments that we're monitoring from the Facebook live stream. And of course, we will leave plenty of time at the end of Kevin's presentation to address as many questions as we can. And so with all of that stuff out of the way, I am very excited to pass things off to Kevin. Kevin, thank you for joining us.
Kyle, thank you for having me. Thank you to my NAMI Tennessee family. Real quick, I guess I'll call it housekeeping item for me is I am a huge fan of Tennessee because you guys are the barbecue capital of the world. And so my good friend Jeff knows anytime I can visit Memphis or Nashville or many other places in Tennessee, I'm always there. So I'm going to get right into it because we have a lot of ground to cover. And as Kyle mentioned, I want to make sure I allow time for us to have a conversation. We can call it Q&A, but I like to have a conversation. So Kyle, if you want to go to the next slide. This is a snapshot of my bio that Kyle's already gone over. The only thing that I'd mention here is, like Jeff and many other NAMI advocates, I'm very involved. We are all very passionate. This is all very personal. I don't serve on all these committees to pad my resume or to boost my ego. I do it because this is something that's obviously very personal to me, that I'm very passionate about. But I also am a very strong believer, if you don't get involved, then you will never realize the change that you seek. It's easy to stand on the sideline and complain about what we don't have. But if you want to see change, you have to become involved. And so that's why I do what I do, as I'm sure is the same for many of you. We can go to the next, Kyle. This is a short video. You can go ahead and start. It kind of tells you my story, my journey.
A Metro Detroit father has turned his unimaginable pain into a passion for helping others. As Fox 2's Dina Sedefati shows us, his goal is to save lives by keeping the conversation about mental illness alive.
Like any proud dad, Kevin Fischer's walls are filled with pictures of
My apologies, everyone. Just need to start it up again.
his son.
If you notice, he's catching a touchdown just as he's crossing the goal line.
His son, Dominique, an All-American kid, bright, well-liked, a three-sport athlete.
Always lit up a room, big smile. Everybody says this about their child, but everybody loved him. Everybody loved being around him.
But when Dominique went off to college, Kevin says he watched his son's bright light grow dim.
Dominique's diagnosis came as a complete surprise to his mom and I. His mom and I had divorced about a year prior in 2006. Dominique was away at John Carroll University his sophomore year and playing football, and from what we knew, doing very well. We saw no signs of mental illness with him.
So the initial diagnosis was surprising, schizophrenia, and then an additional diagnosis of bipolar disorder. Kevin learned mental health issues tend to affect young people between the ages of 15 and 24. Schizophrenia and bipolar disorder often appearing in the late teens and early 20s, just as Dominique's did. At first, his treatment and medication were working.
But like most schizophrenics in particular, there came a point where he convinced himself that the medication wasn't working, he didn't need it, and he took himself off his medication.
And then on June 27, 2010, at just 23 years old, Dominique was lost to suicide.
Losing Dominique, I always say, should have killed me. It was more than I could imagine.
Through the unimaginable pain, Kevin found his passion. He runs a foundation in his son's name, hosting events like this one, raising funds and awareness. He's also the executive director for the Michigan chapter of the National Alliance on Mental Illness, NAMI.
I can only say I wish I knew of NAMI before, because it really does provide the support and guidance that I was looking for when I was trying to help Dominique. There's a lot of support there.
Kevin says this is his last job he will ever have, his last fight. His dream that everyone will embrace the issue of mental health care. He wants to keep the conversation going until mental illness is treated like any other illness.
1 in 4 adults, 1 in 10 children live with mental illness. That's a big number, and it's treatable. It's a winnable fight.
If you or someone you love is in crisis, please call the Suicide Prevention Lifeline at 1-800-273-TALK.
So that tells you a little bit about how I got here. Like many of you, it's with lived experience. I always like to address myths about mental illness. And we all know this, so I'll move through it quickly. Mental illness does not discriminate, not by race, religion, socioeconomic status, party affiliation, sex or sexual identification, or even location. Mental illness simply does not discriminate. It does affect us all. We can go to the next, Kyle. And we all know these numbers. 1 in 5 adults, 1 in 20 experience a serious mental illness, and about 1 in 6 U.S. youth between the ages 6 and 17 experiences a mental health disorder every year. Unfortunately, not enough of us are receiving treatment. We can go to the next. You'll hear me talk a lot about stigma because with all of the work that I do, with all of the really smart people that I have the privilege of working with, whether it's legislators, doctors, criminal justice, the gamut of people who we interact with in this space, Whenever I sit in the room and I talk about what resources we have available and why aren't people getting the help that they need, I draw a big circle on a table, on a piece of paper, and it always comes back to stigma. Stigma is the leading barrier that prevents people from taking the very first step to getting the help that they need. Stigma prevents people from maintaining their treatment plans. I experienced this with Dominique, and I didn't say it in that video because that video is about 6 years old. But I remember a time when Dominique actually told me, when I found he was self-medicating, he stopped taking his prescription medication and was self-medicating with marijuana and alcohol. And when I asked him why, he said, I would rather my friends think I'm high than know that I have a mental illness. So that's how strong stigma is. We can go to the next. There are many reasons that stigma affects communities and cultures differently, though. In the next slide, we can go to the next one, Kyle. In the next slide, I'd like to address the issue. Like mental illness, stigma does not discriminate, but it does vary by community and culture. The stigma in the general population about mental illness is different than it is in the African American community. It's different than it is in the Muslim community. It's different than it is in the Asian American community. It's different than in the LGBTQ community. Stigma varies by community and culture. And we as a society have to recognize that and understand there is no one size fits all answer to this. We have to recognize that racial disparities exist. We have to recognize that there are stigmas within cultures. It's, a lot of times when we talk about this, we talk about external factors, and when we talk about racial disparities, we say, well, when people of color seek treatment, they're not treated the same as Caucasian Americans. And it's not that that's not true. That is true. But the other side of that coin, and I'm just using that as an example, the other side of the coin is within communities of color, we have to change how we look within at mental illness, behavioral health care disorders, suicide prevention. We have to address that internally and find a way to trust the medical community, to trust law enforcement, to do the things that we need to do to become a better community, to live a higher quality of life, and to actually save lives. We can go to the next, Kyle. Dominique died by suicide. That's what the death certificate says. Stigma killed my son. And I'm very blunt and clear about that. Dominique stopped participating in his treatment plan because he was made to feel ashamed of his diagnosis. Dominique not only was it friends, it was family, it was close family who convinced him that you don't need to take medication. There's nothing wrong with you. You need to just focus harder. You need to pull yourself up by your bootstraps. Dominique was diagnosed bipolar schizophrenic. We're way past bootstraps when a person has voices in their head telling them that God works for them. So again, when we talk about stigma, and when we talk about racial disparities, that pendulum swings both ways. There are external factors and there are internal factors in our communities of culture that we have to address. We can go to the next, Kyle. This is another really short video that I'd like to play. Go ahead, Kyle.
Family prayer? Yeah. Okay, well, let us pray. Who's first? Me. Okay, go ahead, Jeffrey.
He is a character in his own self.
All the way around, just very special.
He's just my miracle child. And I treated him like he was a miracle and that he was loved every single day. The only thing that he ever said he wanted to be since he was a small child, a superhero.
He loved dressing in costumes. He'll come out wearing a Batman mask and Superman cape.
I can remember that day like it was yesterday.
How could this happen?
It was incomprehensible to me.
A lot of parents are burying their children.
People always say black people don't do that. Yes, here's a picture.
Pay attention, something's happening here.
We need to respond expeditiously because people are dying.
I don't think sometimes that kids understand there's no coming back from this.
By what age do young people fully understand what it means to die by suicide?
That is something that's gonna always stay with me to the day I die. Hear my baby cry out to me because I was a different cry.
Shout out to my family.
Okay.
Love you, Mama. I love you, Daddy. Mwah.
We can go to the next. You know, it breaks my heart every time I watch that video, as if these were my own children. I still work in communities here in Detroit where I run into, frankly, Black families who still don't believe Black people die by suicide. When you go back to, I believe it's 2018, the CDC, or Centers for Disease Control, started reporting that the suicide rate for African-American boys between the age of 5 and 12 is actually twice what it is for their Caucasian counterparts. Again, stigma swings both ways, internal and external. And we as a country have to understand how these factors are affecting our communities and do something about it. Stop looking for somebody else for the answer. We're the answer. We are the help that we seek. I'm sure you're familiar with many of these stats, so I try not to dwell too much, but these are 2020 numbers that actually show the suicide rate in the United States actually dropped from 2019 to 2020 slightly. We lost just under 46,000 Americans to suicide. But even there, most people don't realize we lose twice as many people to suicide in this country as we do to homicide every year. Yet when we turn on the 6 o'clock news, what do we talk about? It's always homicide. And we're reactive. We're reactive to mental illness. We're reactive to suicide. And we have to change that. We can't wait until people are in crisis. We have to be proactive. So we can go to the next, Kyle. Since I think we missed one. Can you go back to, it's just something I want to cover really quickly. Yep, right there. So since 1999, the suicide rate in the United States has increased by 35%. But in the African-American community, it's increased by 78%. So again, when we have the thought that Black people don't die by suicide, nothing could be further from the truth. We know that just under half of people who die by suicide had a diagnosed mental illness, but 90% of the people who die by suicide show some symptom of a mental health condition prior to their deaths. 78% of people who die by suicide are male, but we know we can't let that number mislead us because women attempt suicide at a greater rate than men. Men tend to complete more because we tend to use more lethal means. But unfortunately, in recent years, the gap is closing because women are starting to utilize more lethal means as well. In the last 2 years, I believe the greatest increase in suicide rate is among teenage girls, and particularly teenage girls of color. So we cannot ignore what's right in front of us. And then, you know, we talk about the LGBTQ community, which is heavily impacted by mental illness and suicide as well. Again, no one size fits all solution to this. Okay, Kyle, I'm sorry. So I was really proud, and it's unfortunate to say this, but about 2.5 years ago, almost, I think it was the day after the George Floyd killing, our new CEO at the time, Dan Gillison, made the first national public statement that I recall hearing that says, racism is a public health crisis. And that's not just in the African-American community, that is in all communities of color. And that's important because, again, we have to get out of this mindset that there's a one-size-fits-all solution to this. While the rate of mental illness in African-American communities are similar to the general population, the disparities that exist in regard to mental health services do exist. African-Americans often receive poor quality of care and lack of access to culturally competent behavioral health care. And that is inclusive of all communities of color. It's not just the African-American community. African-Americans with a mental illness have lower rates of mental health service use, including prescription medication, outpatient services, but higher use of inpatient services. Why is that? Because we have an unfortunate tendency to ignore mental illness or signs of mental illness until it reaches crisis. And when it reaches crisis, we end up in the emergency room. We end up on more medication, and we end up in the jails. And that's not where we need to be. You don't get help. We don't need handcuffs, we need help. We can go to the next. While there's much we need to do to address racism in this country, we cannot forget the importance of mental health as we do so. The effect of racism and racial trauma on mental health is in fact real and cannot be ignored. One of my greatest frustrations is that we keep trying to sweep this under the rug, and we keep trying to make the assumption that we're all the same. We are not. And that's not a bad thing. We have to recognize and respect our differences, but absolutely recognize that there's no one-size-fits-all solution. The disparities in access to mental health care in communities of color cannot be ignored. The inequality and lack of cultural competency in mental health treatment cannot be ignored. We can go to the next. You know, what happens at the intersection of mental health and one's experience as a member of the Black community does vary. While the experience of being Black in America varies tremendously, there are shared cultural factors that play a role in helping define mental health and supporting well-being, resiliency, and healing. Part of this shared cultural experience are our family connections, values, expressions through spirituality, music, reliance on community and religious networks are all enriching and can be great sources of strength and support. But we cannot leave out, if we need professional help, we need to seek that. We need to not think that we can just pray it away. We need to understand that while meditation and music and all of those things are great, when you have a serious mental health diagnosis, you can't meditate it away. You can't pray it away. You can't sing and dance it away. That it's okay to seek professional help if needed. We can go to the next. Discrimination and inequality that can significantly affect a person's mental health. Being treated or perceived as less than because of your color of skin can be stressful and traumatizing. I see and work with so many families of color that once they decide to seek help, they become demoralized sometimes when they go and they know they're not being treated with the same dignity and respect as everybody else. African Americans, and again, I say African Americans, but this applies to all communities of color. We're less likely to receive guideline consistent care, less frequently included in research, and that goes both ways. We're not invited, and when we are invited, we're not participating enough. And I like to use this analogy when I'm in the barbershop, and I get in trouble a lot in the barbershop because my mom says I pick fights. I like to have engaging conversations. And one of the examples that I use is jury duty. There's nothing like sitting around the barbershop, listening to people tell what lengths they go to get out of jury duty. And that's true in all communities. But in communities of color, when you have to go to court and you're facing a jury and you don't, when we say jury of your peers, you don't see anybody that looks like you, the very next complaint is, I was convicted or I lost my case because there were no people of color. It was an all-white jury. Well, remember, you were just bragging about how you got out of jury duty. What I said early on, if you want to see change, you have to be a part of the change. You can't sit on the sideline and just complain. Go sit on the jury. When we have an opportunity to participate in medical research, I know we have a historical reason for distrust in the medical community, but it's not going to get better if we don't find a way to bridge the gap. We can go to the next, Kyle. In the general population, I think it is about 47% of people with a diagnosed mental illness gets care or treatment in a given year. But in the Asian American community, only about 23%. African American community, about third. Non-Hispanic, mixed, multiracial, about 43%. In the Hispanic or Latino community, about 33%. And then here in Michigan, this is one that struck me when I went to do research to do a presentation for a Muslim organization. I can't even find good data, mental health data on the Arab American community. So we have a long way to go in understanding how mental illness affects our communities, and then encouraging those communities to seek the help that's needed. We can go to the next one, Kyle. There are many barriers to care. Despite recent efforts to improve mental health services for African Americans and other minority groups, barriers remain regarding access and quality of care. And some of the barriers are stigma associated with mental illness, distrust of the healthcare system, lack of providers from diverse racial and ethnic backgrounds, lack of culturally competent providers, and lack of insurance and underinsurance. You know, one of the greatest challenges I face in communities of color is I often receive calls from families, again, when they're ready to seek service for themselves or a child, is, can you find me an African-American male, or can you find me an African-American female or provider? And we know that there's a significant shortage of behavioral health care professionals in the country as a whole. And it goes without saying, there is a deeper shortage in communities of color. I think only about 2% of all psychiatrists in the country are Black. And I don't know off the top of my head the numbers for other communities of color. But I say that to say this: yes, it is an issue. But I don't want us to not seek treatment because we can't find someone who looks like us. Because I've had personal experience. I've received treatment services from a white provider, and frankly, cultural competency never became an issue for us. There are providers out there who recognize that there are cultural differences and who are trying to meet that and receive proper training and experience to get there. It's not perfect, but we can't afford to not receive service based solely on the fact that I can't find someone who looks like me. The issue of insurance or underinsurance, if you're familiar with the Certified Community Behavioral Health Clinics or CCBHC, this is a game changer in respect to now you can receive services or treatment regardless of the severity of your diagnosis, regardless of your insurance status, and regardless of your ability to pay. And I'm really proud that Senator Stabenow of Michigan and Senator Roy Blunt of Missouri, in a bipartisan effort, were able to create this and, excuse me, and now make it a national program that we can all benefit from. We can go to the next, Kyle. The importance of family privacy, lack of knowledge regarding available treatments, and denial of medical treatment is a huge issue. Excuse me. Many of us in minority communities know that, you know, some of the stigma or the practice is what happens in this house stays in this house. We don't want our neighbors, our friends, the people we sit next to at church or work with to know that someone in our family has a mental health challenge. We got to get past that. We can't, when we talk about stigma, if you're not ashamed to say my son or daughter is diagnosed with diabetes or heart disease, then we shouldn't be any more ashamed to say that a person, and frankly, it's nobody's business, that's up to you, but my child's dealing with depression, or my child's dealing with something even more seriously. Not receiving adequate treatment hinders our quality of life and life itself. And so we have to do better, and we have to do that for us. We can't wait for somebody else to give it to us. We have to decide to do that for us. We can go to the next, Kyle. So doing some research a few months ago, I came across an article that talked about the difference or the racial disparities people of color experience when they do seek medical treatment and behavioral health care treatment. Physician-patient communication differs for African Americans and whites. One study found that physicians were 23% more verbally dominant and or engaged in 33% less patient-centered communication with African American patients than they did with white. What does that mean in layman's terms? We get talked at instead of talked with. We talk as behavioral health advocates about self-determination and person-centered planning. We deserve that same quality of treatment and options as anyone else. Unfortunately, that's a third of the time not the experience. Black people with mental health conditions, particularly schizophrenia, bipolar disorders, and other psychoses are more likely to be incarcerated than people of any other race. I have had the unfortunate privilege of walking all three Wayne County jails. Wayne County is Detroit primarily. And I have a really good friend, Chief Robert Dunlap, who is the chief of jails. And we walked all three jails several years ago. And if you've ever had the pleasure, and I'm being a little sarcastic, of walking these jails, especially in a major urban city, it's disgusting. And the mental health floor, which is the 7th floor, you can smell the urine and feces when you're in the elevator on the 2nd floor. Somehow, jails and prisons have become the de facto mental health treatment facilities in our country. And we all know that no one's really receiving effective behavioral health care treatment when they're incarcerated. And the shame of it is, when I walked those jails, there were nothing but people who looked exactly like me in those jails, and they were desperate. And the larger or equally important problem is most of them are there for misdemeanor crimes and they just couldn't make bail. And so they languish in our jails and prisons across the country needlessly. And unfortunately, that is the highest cost to serve place to quote unquote provide treatment. We can go to the next, Kyle. The Washington Post started doing research back in 2015. And this is why I joined CIT. And I didn't even know the statistics. I just heard enough on the news that showed nationwide at least 25%, and I've seen some estimates now that say as much as 30% of people who are shot and killed by law enforcement officers in this country have been diagnosed with as much as 30% mental illness. Who are shot and killed by law enforcement. Kyle, I'm getting feedback somehow. Okay, stop. And people with untreated mental illness are 16 times more likely to be fatally shot during an encounter with police than with their mental illness under control. So one of the questions that I'm often asked is, how do we keep police away from or out of behavioral health runs or calls? And my answer to it, and it's not taking all the responsibility off law enforcement, because there's going to be times that law enforcement will be required. When there is there's an opportunity for someone to be injured, then law enforcement has to be involved. But my answer is this: the best thing we can do is to intervene early. And I use myself as an example. If my wife knows I'm stopped taking my medication and she sees that my behavior is changing, that's the time to intervene. You don't wait until I've got you trapped in the bathroom with a butcher knife to intervene, because then you are inviting the police into your home. Now it requires law enforcement. And my question, I know that's a bit of an extreme example, but my response to people is also, when do you call the police? Most of us call the police when we're scared, especially in communities of color, because there's such distrust of law enforcement. And obviously there are some cases where that's justifiable. I'm gonna pause here and say this. I grew up in a community in Detroit, actually a little city called Highland Park. My next door neighbor was a policeman. The next door neighbor to him was a policeman. The neighbor across the street was a policeman. So I grew up around law enforcement, and I have a healthy respect for them. And as a CIT coordinator and trainer, I will tell you, of the hundreds of officers I've trained, regardless as to their race or gender, most of them, I would go as far as saying 98, 99% of them are trying to get it right. And they are very passionate, and they are very aware of how mental illness affects the communities. But we have a few bad cops, like we got a few bad plumbers and a few bad electricians, and that needs to be addressed. But I'll get back to this. Don't wait until it's crisis to intervene. Intervene early. That's the best way to keep law enforcement out of those situations. We can go to the next. Here's another study. The Journal Annals of Epidemiology did a study and showed that police are more likely to shoot and kill unarmed Black men who show signs of mental illness than white men who exhibit similar behaviors. All you got to do is turn the news on every day. This is not breaking news to you. Black men are least likely to get treatment for active mental health diagnosis among major demographics. Men 18 to 27 are also less likely to be treated. We can go to the next. And one last study, according to the Washington Post study, and this goes back to about 25% of people who are fatally shot by law enforcement were confirmed, key there being confirmed, to having mental illness. We know that there's a larger percentage that are undiagnosed or unconfirmed that exhibited symptoms of mental illness that were also shot and killed by police. And unfortunately, a majority of those are people of color. We can go to the next. Chuck Wexler, who was the executive director for the Police Executive Research Forum, simply said, we have to get American police to rethink how we handle encounters with mentally ill. The training has to change. I have a lot of friends in law enforcement, and I have great respect for my friends in law enforcement. But I have a debate with them pretty often. And one of them is when I tell them law enforcement has 3 get out of jail free cards. 1, I feared for my life. 2, the person failed to follow my commands. And 3, I was following my training. And every time they stop on I was following my training, I tell my police chiefs, your training needs to change, and you know it. You can't just keep falling back on that as an excuse. My bad, my training, I followed my training, is not good enough. When you shoot and kill an unarmed person, or when a family calls you and says, Kevin I just need you to help me transport him, to get him stabilized, and he ends up dead. That's not good enough. And that's why I joined CIT And honestly, when they presented me with the opportunity in January to be president of CIT International, the group of people who reached out to me made it very clear that the reason they thought the time was right for an African-American president is because of what's going on in the country. And they wanted to have somebody with a seat at the table with the opportunity to affect change. If you want to make change, protesting is fine. But standing on the sideline and complaining is not good enough. You want to change the game, you get in the game. We can go to the next, Kyle. And I'm getting to the end here. I saw this on social media and I just couldn't avoid it. Equal rights for others does not mean fewer rights for you. It's not pie. We're not saying take your foot off our neck so we can put our foot on yours. That's not the conversation. When we talk about equality and equity, we mean for all. We can go to the next. So where do we go from here? We have to educate ourselves, and we have to educate the communities, and we have to have these tough conversations. We must confront and really address systemic racial discrimination and racial disparities in behavioral health care. We must understand that there is no one-size-fits-all solution, that culturally competent care is necessary, and make sure that it is available. I'll go back, I'll pause here again to say, if you don't have a provider who looks like you, please don't let that stop you from seeking treatment, though. We must encourage young people, and particularly young people of color, to pursue careers in behavioral health care. Again, we can complain about what we don't have, but we have to change it, and we have to build a bench or a pipeline of behavioral health care professionals. And then we have to continue to advocate. We have to educate and advocate in communities of color, eliminating the stigma of mental illness. And when people of color are ready to perceive behavioral health care, we must be treated with the dignity and respect that we would give to anybody. We can go to the next, Kyle. The one last quick, I call it fun fact about suicide. I'm often asked about this, not only because I lost a son to suicide, but I experienced some suicidal ideation myself after losing him. People think that people who die by suicide want to die. In 90% of the cases that we are aware of, nothing can be further from the truth. I've never wanted to die. I wanted to end the pain that I was experiencing, the emotional pain. And to do that, we have to intervene early. Proactive mental health care is suicide prevention. I'm excited about the new 988 line. I understood the value of the 800 crisis suicide prevention line. I always get a little concerned about that because, again, we're reactive instead of proactive. Proactive mental health care is suicide prevention in every community. We can go to the next, Kyle. What we know is that when people seek treatment and receive proper treatment, every day, millions of Americans overcome the challenges of a mental health diagnosis and go on and live very fulfilling lives. And that's the hope that I always cling to. We can go to the next. Stop racism, stop stigma. That's my message for everything. Not just in the African American community, but in all communities. Communities of color just tend to be disproportionately affected. But again, there are external and internal factors that we have to take responsibility for. We can go to the next. The last is, I am CEO of everybodyversesstigma.com. I didn't come on to sell you t-shirts, but I want people to understand when we say everybody, I mean everybody. Stigma, like mental illness, affects us all, and it's going to take all of us to change this. We're talking about a cultural change. And so I tell people all the time when they ask me about Everybody Versus Big Stigma being a business or a brand. I started Everybody Versus Stigma because it's a movement, not just for business purposes. We can go to the next, Kyle. So these are some of the advocacy related issues that we're working on in Michigan. And one of the top priorities is reimagining a diverse public behavioral health care system and many others. And I'm sure you're facing some of these things in Tennessee as well. So we can go to the other. And I think the last is just contact information and resources. So that's my presentation. I thank you for your presence, patience, and participation. And I'm looking forward to, we got about 15 minutes for Q&A.
Wonderful. So Kevin, thank you so much for that presentation. And I also just want to thank everyone for bearing with the technical difficulties. Zoom does not make it easy to share audio along with your visual presentation, folks. So thank you for bearing with that. We'll do what we can to scrub the recording when we post this. But anyways, I want to go right into Q&A. Really glad that we have 15 minutes. To start, just want to iterate that there are some folks who are very glad to hear about your story, really impactful. Someone said, this is what makes what I do worth it after hearing your story. So thank you for sharing that. I want to go quickly over to the CCBHC, which is Certified Community Behavioral Health Clinic. And Kevin, I was wondering if you could talk a little bit more about that. For the folks in Tennessee, just, since we're crossing state lines here, I want to make it clear that we do have CCBHC funded clinics in Tennessee. We are one of the 42 states participating in that model, and I'm not going to name specific behavioral health care centers at this time, but if you research and look for CCBHC on the center websites, you should be able to find some information. But Kevin, could you talk a little bit more about what that is and why it's so important?
Yeah, certified community behavioral health clinics, to me, I describe it as a game changer. I think CCBHC is the most significant behavioral health care legislation of our lifetime. And that goes back, I'll date myself, that goes back to JFK's last major piece of legislation he signed was the Community Mental Health Act of 1963. This opens up, oftentimes, and I have to use Michigan as an example because it might be a little different in Tennessee. So we have community mental health. We have 46 community mental health agencies in Michigan and also 10 what we call prepaid inpatient health plans. And those are referred to as the community safety net. So it implies that anyone in the community who is in need of behavioral health care treatment can receive it. But that's not really true. There are gaps. Community mental health in Michigan is Medicaid funded, which means you must be Medicaid eligible. You must meet Medicaid income guidelines and all of those things. The other thing about our community mental health system is it is primarily built to serve people with severe and persistent mental illness, not mild to moderate. That typically falls on Medicaid health plans. The Medicaid health plans in Michigan do not at all have a good track record of providing services to people with mild to moderate mental illness. So getting back to how does that correlate to CCBHC? Public behavioral health care system, community mental health can turn you away if you don't meet Medicaid guidelines. They can turn you away if you are not sick enough. The health plans often won't cover you if your mental health diagnosis is too serious. And so where CCBHC fits in is three specific areas of opportunity is when you go to a CCBHC provider, you can receive services regardless of the severity of your diagnosis. So nobody can turn you away because you're too sick or not sick enough. You can't be turned away because on the basis of your insurance status, because CCBHCs they will ask you if you have insurance. They'll take you through the routine intake process, but you can't be turned away for not having insurance, nor can you be turned away for your inability to pay. So the barriers most people face are, if once you get past stigma is, Am I aware of provider agencies near me? And can I afford it? Well, this takes all of that away.
Thank you, Kevin. Really appreciate that response. The next question, and before I ask this question, I just want to remind folks that if you have a question, put it in the Q&A on Zoom. We're also listening to your questions on Facebook. Just to call that out to make sure you all know it's real. Cheryl, thank you so much for your comment. That was a powerful presentation, Kevin. So thank you for your presentation once more. The question I want to ask now has to do with 988, because we're really excited about 988. 988 went live on July 16th. That's this past Saturday. It is a game changer for mental health crisis. We are very excited about it. It goes to the National Suicide Prevention Lifeline, and we want the proactive and the reactive responses both, right?
Yep.
Now, the thing that the question has to do with, when we're talking about communities of color, can you talk a little bit about some of the difficulty that lies there? Personally speaking, I can talk about my social media and how there are already lots of advocacy around, if you are a person of color, beware calling 988. That's already popping up on my feed. And so I'd love for you, Kevin, to address kind of the nuanced difficulties. I mean, just to put it out there, right, we're having this discussion about mental health crisis in communities of color, and yet we had to go and talk about a million different other factors that all go into this, because there's so much nuance and so many things to talk about. So Kevin, please take it away.
So, it's interesting because I had to do an interview yesterday with a reporter, and she asked me if she thought 988 would increase access to treatment for communities of color. And obviously it's too early to tell. That's my hope. Some of the benefits of 988 is, of course, one, you only have to remember a 3-digit number instead of a 10-digit. Also, that 988 will provide you with a behavioral healthcare response rather than calling 911 and receiving a law enforcement response. So that's a benefit to everyone, and again, in communities of color. So I encourage people, Kyle, I've heard what you just said that you've seen on social media. And, I get in trouble in the barbershop all the time because I'll say stuff that people of color don't want to hear. We have to take on some responsibility, and we have to take on some risk. And what I'm saying is, it can't get better if we're not a part of it, if we're not engaged. Why say 988 is 4 days old and we're already saying don't use it? Why? It eliminates the thing that we've been complaining about the most. And I'll just be blunt. In the African American community, we fear calling law enforcement because we believe, and there's data out there that supports, they disproportionately hurt us, kill us, incarcerate us. So when you have a brand new option to not make them a part of that, why are we already saying don't use it? That just doesn't make any sense. The other thing about 988, and I've struggled with this, is we've been talking about 988 for a couple of years now, and we talk about it primarily in the context of replacing the suicide prevention hotline. My concern with that is our messaging could be falling short in terms of reminding people that 988 is much more than that. And you hit it on the head, Kyle. 988 provides proactive resources too. And I want us to please think about behavioral health care in a proactive manner rather than a reactive manner when we're waiting until crisis, because that's when people get hurt. That's when outcomes are their worst. There's study after study that shows early intervention leads to better outcomes. So let's not forget that 988 is proactive, and you can call there and seek out behavioral healthcare resources, not just suicide prevention.
Thank you, Kevin. Okay, and finally, our last question. I like to end things on a higher note, and we're talking about really difficult things here, and I don't want to dismiss that either. At the same time, Kevin, what are some of the, whether it's from CIT International, from NAMI Michigan, from things NAMI Tennessee Executive Director Jeff Fladen has told you are going on in Tennessee. What are some of the victory moments of, hey, this training is being tweaked, this approach is being managed better, and here's the progress we're seeing?
So right off the bat, I think 988 is a victory. I really do. I think 988 is a victory for everyone. I'll tell you a really quick story. I'm encouraged despite all of the negative numbers or statistics that we've discussed, I'm encouraged. I was facilitating a CIT, and for those who are not familiar, CIT is Crisis Intervention Team Training, which is the gold standard of crisis response models in the United States. I was participating in a training about 1.5 years ago, and I was talking about racial disparities and how law enforcement responds differently in communities of color or in urban communities than they do in primarily, suburban or Caucasian communities. And I made a statement in my presentation that was unscripted, and I said to the officers, I can provide you with the training, and we were talking about verbal de-escalation, but I said, I can't change what's in your heart. Because if you have, those feelings, those things in your heart, you are who you are. Immediately after my presentation, an officer, this was a 20+ year veteran who looked like nobody's gonna change his mind. He's like, he had that look on his face, I'm set in my ways, I am who I am, and you're not gonna change me. He walked up to me and he thanked me for the presentation, and he said, I'm going to challenge you on one thing. He said, you're absolutely wrong when you said you can't change what's in my heart. He said, because since you made that comment, I've sat here and I've searched my heart and been honest with myself. And he said, first, I will admit that, yeah, I have some biases. He said, but I'm giving you my word today that I am going to try to change that, and I'm going to make a conscious effort. He said, so I want you to continue to include that, because whether you know it or not, you can change hearts. So that's what gives me hope, and the more of us that get involved, and that's the key again, get involved. If you're standing on the sideline complaining, then you're part of the problem. If you want to see change, be the change you seek. And I know that sounds cliche, but we can't wait for somebody else to save us. You got to save yourself.
Awesome. Well, Kevin, thank you so much for your presentation. I want to end on this, that this webinar is being recorded, and it's going to automatically post to Facebook as soon as we get off the call. We will also post it on our YouTube channel, NAMI Tennessee YouTube channel, by the end of the week. I also want you all to save the date for Wednesday, July 27th at 6:30 p.m. Central Time and 7:30 p.m. Eastern Time for a webinar panel, which we're collaborating with NAMI Davidson County here in Nashville, Tennessee. It's going to feature a report on the Davidson County Asian Pacific Islander, or API, Community Needs Assessment, which is a survey developed to capture a picture of stress-related resilience and mental health needs among the local API community, particularly during a worldwide pandemic and rise in anti-Asian discrimination in the United States. So please check that out next Wednesday. And with that, I want to thank Kevin and NAMI Michigan again. Are there any final words before we sign off?
I look forward to seeing you guys over barbecue soon.
Amazing. Well, we will make that happen. Well, Kevin, thank you so much. And as always, if you have any questions, please don't hesitate to reach out. Take care, everyone, and have a great Wednesday.